Well, the doctor is in, and it's geriatrician Dr. Shandini Sharma. And today we're talking about a very sensitive but common issue in other adults, older adults, and that's constipation. Thank you for being here today.
Thank you.
I want to start first with we just talked about this in the break. It's the best kept secret.
It is.
What do you mean by that? Is something people don't want to talk about?
Yeah. Constipation is the best kept secret. I mean, you can get a history of what fever was, what weight was, what's the blood pressure, blood sugar, and all that stuff. But when it comes down to asking, are you constipated? Is your bowel moving regularly? That's the best kept secret. Best kept secret. And we're in the nursing homes, it's even harder at times to figure out whether they're having a BM or not. If the senior is living alone at home and has even the slightest forgetfulness, it is almost impossible to find out. Almost always when I ask the history, being a geriatrician, all my geriatrician friends will agree, when we ask a history of how's your bowel movement, the person would say, oh, it's regular. Well, then you have to ask the next question, like, because most people think that having a bowel movement within however many long number of days is not constipation. Whereas there is actually a scale. So you can go and read about that scale, and right this minute the name of the scale went out of my mind, but the Bristol Stool Scale, Bristol like the town Bristol, B-R-I-S-T-O-L, Bristol Stool Scale, which will tell you what is normal BM, what is loose BM, and what is hard BM. Most people understand constipation as obstruction. It's almost as if you're asking, have you not had a BM in 99 days? I'm kidding. But, you will not laugh when I say there have been people who report that having one BM in 7 days is normal for them. That's not a human being. There are people who have reported like having little, and I'm not being gross here, this is geriatrics, this is real life, little pellets, and that's been for decades. Jokingly, once I've had a report, I say, that's actually for goats, not for human beings.
Yeah, no kidding.
Because that's what's going to lead into the other point that we wanted to make in our little segment today, was that alternating constipation with diarrhea. If you have constipation and you've had hard stools for weeks and weeks and months, then the body wants to get rid of that fecal matter somehow. The person will undergo a leaky stool over that hard constipation. This is the colon I'm trying to say in the air. There, if it's got lots of stool sitting in there, the bowel will try to get out as a leaky stool, so the patient will have diarrhea. But the important thing is you have to figure out if it was alternating constipation with diarrhea with several weeks in between. Of course, you always, if there's a change in bowel habit, even as a senior, you want to go to your GI specialist and say, can I get a colonoscopy, whatever age?
Don't put it off. That's the message right there. Don't put it off, even if it's a secret. Don't be embarrassed. Address it.
Talk about it. You can't treat it if you don't even talk about it.
Amen to that. Thank you, Dr. Sharma. I appreciate it. Well, if you have any questions for Dr. Sharma, you can email it to us at newson6@griffin.news.